What our feeling about the telemedicine opportunity in 2010-11 with a $900 billion healthcare plan, we know it's going to create downward pressures on reimbursements. It's not likely to affect all the providers equally, and there's going to be a definite increase in cost savings products and services. With 32 million more people entering the healthcare system, we see there's going to be this substantial increase in potential patients and a severe shortage of doctors and nurses predicted. The technologies that leverage, this is going to be very important. I think the time is ripe. I think it's going to break if it doesn't start using telemedicine. Then I don't know how they're going to do it. We have been looking at, as a company, diversifying. That's why we're into the sleep and teleclinics. We're looking at new services and new geographies, because all the companies in our space are 100% reliant on reimbursement, as are physicians and hospitals, and we all know which way that goes. It just reduces the risk. Our roadmap, and this is an eternal slide, forgive me, but this is, we've been in the cardiac monitoring business. We've brought in sleep in 2009-10, and we're well into telemedicine services with the teleclinics and other things we're looking at, and we're also looking at wellness services. But we know that that's a huge risk because that's a huge business, but still, those are the things that we've heard with various conversations around the room as well. This is just our portfolio of gear that we have back from, when the first company that was Intramedics, we came out with what was called King of Hearts. I don't know if anybody knows what that is, but that's it's usually in physicians' offices and hospitals. It's check off a King of Hearts, which is one of the first event monitors. We make them. We sell them to our competitors as well. So these are all our pieces of equipment up until the telemetry, which is probably the newest type of equipment we have. That's real-time telemetry. This is what we can show you, we can demonstrate it. It's all FDA approved, but we're not marketing it. We have lots of it on the shelf. This is essentially a scale. You have a spirometer, a glucometer, blood pressure, pulse ox, 12-lead ECG, a hub, and a way to move this information around for whoever wants to do it. This is kind of redundant of whatever, you all know this more than I. This is like me telling our people what's going on, so I'll move on. This was, a presentation excerpt that we just gave to some stockholders, and that, what's our position? Because of our infrastructure and our technology and our clinical engine and our relationship with the insurance company, we have more than meets the eye to the outside world. With the large response centers we have, the ability to move data, the work and data flow that we've achieved and perfected to some extent, puts us in a position to do a lot of different things. Obviously, we have the cardiac, and that's basically been the business for quite some time. We've added sleep, and we're looking at other areas: disease management, rehab, the teleclinics, emergency medicine, monitoring patients that are in observation units for the hospital, transportation in the sense that we could be monitoring for sleepiness, or just screening for them for sleep apnea. The global opportunity that I was asked to mention, we just started 3 pilots in Europe, one in Italy, one in France, and I think one in the UK. 3 weeks ago. We just ramped up our call center with 27 languages so that we can handle most all of those countries. Our communications are down, and now we're dealing with the marketing side in Europe. These are the other geographies that we mentioned that we think we can probably diversify globally because of our size and our abilities at this point. And bring American style medicine and also telemedicine, because it actually sometimes is more well received in other countries than here for different reasons, because it's not it's in the public sector 100%. This is the progress towards that in a very short amount of time. We've got all our languages set. Global communications are working fine. The pilot projects are already underway, and the international marketing, which is my job, will start as soon as we see where we're going to do the business first. This is the last slide. Just is kind of a dump here. Well, this is about the barriers to entry. Where there's convergence of technology and there's pervasive computing. One of the most interesting reactions to our customers, which have been cardiologists specifically, is that as more and more people come out with more and more devices, and they're wireless, and they present all this extra data. We can look at every heartbeat in 30 days. It's called full disclosure. They've never been able to see that before. And there is some automation there, but a lot of the doctors, they would like to say, I'd like to drill down and see exactly what happened when you said this or that. So all they're seeing is more and more and more data coming their way. They have less and less time as it is. So at this point, they're actually pushing back about getting more data, which would mean more information ultimately, but they have to dig that information out. What they really want is relevant and actual information, finally. It used to be physicians were less trusting of that being handed to them, and they wanted to see the data to do it themselves. I think now, I don't know if there's going to be a choice. I don't know, is that accurate? I mean, when to put your life in a computer's hands, that type of thing, because that's really that's basically the reaction.
Time for people to accept it.
Right. The parallels to this, we have OnStar, ADT, online banking, web commerce. That's thriving. Nothing seems to be in the way of that. We have, what's really happening is things seem to be frozen. There's a lot of talk. There's no real action. Everybody who's talking about disease management, it's small, cottage level size. It's not big. It's not growing. It's not some company you buy stock in. You got Google and Microsoft. I mean, they're all kind of hanging there. Everybody's kind of hanging. The flashpoints are the physician shortage, the 38 million people, the pervasive computing and communications, lack of time, consumer awareness. They're going to start demanding things. Things may not be ready. We talked about that a few weeks ago. And the global markets are going to be very interesting, how they affect our market. And the missing ingredient, from my perspective only, is seems to be no cohesive, motivated leadership, meaning there's no big gorilla in the room to take hold and say, I'm going to lead. I mean, there's no one hospital in the United States. They're all individuals. I mean, there's big systems like this one, but I mean, still, how can this lead the whole country? There's no one company that it's just a healthcare company that can lead. So it's a very interesting dynamic where on the other side, when you have banks and businesses, they don't seem to have a problem leading. But I think that's part of it. And the sustainable business models, even for the leaders, are an issue.